Hello, everyone, and welcome back to the Gynecast. My name is Dr. Eric Heegaard, board-certified obstetrician gynecologist. I'm here with Twila Dang, my buddy, my boss, my wing person, and we're on, believe it or not, right now, we're not really here. We're meditating in the Himalayas, Twila and I, and seeking our spiritual self.
Can I just sit on a beach and
on
have
beach.
a frothy drink? That's all I want.
shall be, while you're doing that, I am in the lotus position in the Himalayas, meditating with
you
the
get
masters.
Enlightenment, I will get drunk on the
So
beach.
we all seek enlightenment in different ways.
Exactly.
So we're taking a little hiatus, but we're going to give you little topics to think about while we're gone, so you don't forget us, and know that we have not forgotten you.
No, we're
listeners.
working. We are actually diligently working on
Yes.
season 2, and we are working on new episodes. We just don't want to leave you with nothing while we're taking a bit of a break.
Exactly.
We wanted you to have a little something you could hold on to.
Mind candy,
Indeed.
mental floss. So, by the time we are actually, this is actually being cast, or the time frame that we're in right now is gone. But there has been some stuff in the media that about behavior physicians in the operating room.
Yes.
That has not been terribly flattering for physicians. And so I thought we would talk a little bit about this, because I've had, I think it's a bit of a mystery. People feel very vulnerable, and in fact are vulnerable. But I thought I would talk about a little bit about what happens when you take somebody back to the operating room and how people behave themselves.
Yes.
Because I will tell you that I have had surgery myself. I've had procedures. Most of us have had that and have been under anesthesia or sedation.
Yeah.
And just like, physicians and providers are put in the same position as everybody else. And so, believe it or not, we are all sensitive to people's dignity and their privacy. And so, in my case, and in most surgical settings, the physician will see the patient before you go back to the operating room or to the procedure room. You'll see the anesthetist, the anesthesiologist, the nurses, and then we take you back to the operating room, and you are put on the table, and you are given anesthesia and put to sleep or sedated. And
even before that, can you point out something that I really appreciate? Because I have surgery very, very recently on a very specific part of my body.
Yeah.
And what I really appreciated is that over and over again, every single sort of person in the chain said to me, like directly to my face, we are repairing this injury on this part of your body. Yes. Like they got confirmation from me. They even took it a step further. Like my anesthetist put initials exactly where they were going to be doing something specific.
Yep.
The surgeon put their initials in like Sharpie where they were going to be operating. So they knew when they got in the room, it was this part of your body. There's no mistaking. It's not, we did the right instead of the left.
Yep.
And then when you go in and you're super nervous for surgery, it's nice to sort of have, that like there's a point where you're like, why does everybody keep asking it? And then you sort of settle in and go, they're making sure that I know that they know what they're doing. Yep. And that helps create a sense of ease before you wind up going in.
That's right. And we are very compulsive. As you said, people are asking again and again and again, probably, I don't know how many times during and before the surgery, what are we doing? Do you understand what we're doing? What part of your body are we dealing with, et cetera? We have to do site markings. Yeah. And so you can either do it on a diagram or you actually mark the person. And so the chance of actually doing the wrong thing is extraordinarily low.
Yes, absolutely.
But I think I'm more, having seen these videos, I think I want to just reassure people about how really, at least in my experience of doing this for a long time in a number of different hospitals, working with many different people, how respectful people are of the experience that these patients are going through. I am impressed again and again and again. And, the problem is that, we are very used to it because we deal with bodies. We deal with exposed bodies and naked bodies. And if you are in clinical medicine at all, whether you're a gynecologist or a family practitioner or an internist, a surgeon, you are seeing naked bodies all the time.
Right.
And we get kind of desensitized to it. But even so, we try to be very sensitive about preserving people's privacy. But when you are having surgery on your abdomen, on your chest, and your genital area, you are going to have some exposure to the people in the operating room. You need to have the area cleaned. You have to be draped sterilely. And all I can tell you is that it's almost impossible to get around the idea that some parts of your body are going to be exposed.
Right.
But people, it's almost like in my experience, is it's like church. It's like a church setting almost. It's that there's a sense of almost a sacred space in there.
Absolutely.
And
that's that's a really wonderful reference that people will fully understand, because I think as a consumer, as a patient, our immediate thought is not that it's sacred space. Our immediate thought is just we turn inward and we're hyper focused on all the things that we are self-conscious about, that we're embarrassed about. And it's not even necessarily about other people seeing it. It's about us thinking that it looks terrible before you see it, particularly if you go to have something corrected or you're having a surgical procedure to help make you better and you're already going through something. We're hyper focused on, oh, that looks terrible. Or like honestly, like I think I told you, and full disclosure for the audience, about a month ago, I fell and broke my wrist in 2 places. It was not fun. I had to have surgery on that wrist. I became hypersensitive about shaving under my armpits before I had the surgery because they were going to have to lift and move my arm. I was so hypersensitive that I shaved both of them, and they weren't even touching my right-hand side.
How did you shave your...
That was a whole adventure with me and my 13-year-old. She had just learned how to shave.
Because I'm looking at you right now. You've got the splint on your left arm, so I'm just trying to imagine you with your broken wrist reaching over to your right.
That didn't happen.
armpit.
I used my good hand to shave under the arm that was going to have surgery, and then I quite honestly made my 13-year-old daughter help me shave the other one, and it was a bonding experience or a traumatic experience, depending on who tells the story.
Do you remember that part from Mrs. Doubtfire, the movie, where Mrs. Doubtfire, played by Robin Williams, is getting on the bus, and he's got these nylons on, but you can see his hairy legs underneath.
Yes.
And he sits on the bus, and he sort of sits back, scratches his belly, spreads his legs, like,
and
then
the bus driver
is like,
like my kind of woman.
You're like, just like the Lord made you. So
you
didn't want to just have everybody see it just like the Lord made you.
And to be honest, I feel like that's exactly, and you know me, I'm a fairly confident person, and normally I don't even care about that kind of a thing. I genuinely don't, but I was in that setting. It was like, they're going to have to do this, and what if something goes wrong and they need to do this, and what if they can't get access, and what if I have these terribly small veins? I got so far into my head that I wound up focusing on something that was unimportant. And when I went into surgery that day, I was in pain from the injury, but I was really and totally focused on the wrong thing. Like I was focused on, like, what are you going to think if you see these things? Many, many patients do that when they walk into a room.
That's right.
And having a reference that you treat it like a sacred space. Everybody understands church is a sacred space. I think that could completely, for me, that's a paradigm shift in how to think of going into a situation.
And
like
I think, and I will tell you too that, as we're prepping the patient, which prepping means that we're using an antibiotic wash and cleaning the skin, we really try, and I'm always impressed by how the nurses and the scrub people, and there's probably 5 or 6 people around a person on the table at different times, and how careful they are about exposing the part you're working with, covering up the other part, and and we know the person's unconscious. They're not going to remember anything, but there's at least in my experience, has always been that people are respectful and careful about trying to preserve some sense of privacy, even though this person is being exposed and cleaned. And I think it's important for people to know that, and it would not be tolerated. Something where a person is being disrespectful to a patient, even though she or he can't hear anything, and is unconscious, it would, pretty much, hospitals and surgery centers are very sensitive to people's perceptions of these. And now, I'm sure it was less sensitive in the past, but it would not be tolerated behavior for that to happen.
Yeah, and I think, and I know at least some of the things we've seen in the news lately, probably in the last couple of years, we've seen 1 or 2 really sort of high-profile incidents of people sort of taking advantage of that space. And unfortunately, what it does is create this sense of sort of panic for everyday, individuals who are going to get procedures, who have to get things done, and or who choose elective surgeries are now concerned that they're not going to be treated, respectfully, or that they're going to wind up on the internet somewhere. It's kind of that one bad apple, taints the entire bunch, because then people start to panic across the board.
That's right.
And that's not warranted. I mean, I know you work in the field. My husband works in the field. He does surgery as well. And I've had lots of exposure to lots and lots of doctors and surgeons and people that work in surgery centers. And I've always said my experience has always been the same. And I've had unique ability to see how surgery centers work as a patient, as the spouse of a provider, as a parent who one of my children had to have surgery several times as a young child, and so as an advocate who didn't have control of the circumstance, and even during opportunities like that where they would allow me as a parent to help usher my child into surgery so that they weren't upset, so that they could calm down and be put under.
That's right.
The way that I've seen doctors and surgeons handle that entire process has always impressed me.
Yeah.
In that they were always so respectful and always so supportive and always really, really sensitive to the idea that first and foremost a patient is usually scared.
Yep.
Exactly. that we usually, doesn't matter how confident we say we're coming in, we're usually scared. We don't know what's going to happen. Every surgery has risk. Every procedure can have something go wrong. And we're all all of us are supposed to be working together to try to keep that from happening, but life can get in the way sometimes.
That's right.
And the fact that I've always had the experience of having good stewards, in that end. And what I hope is that everybody knows that by and large across the majority of that industry, that the individuals involved are good stewards.
That's right. And, so if you think about going to surgery in terms of different kind of phases, there's the preoperative area, and then there's getting to the operating room and getting prepped, as we call it, cleaned off and draped in sterile drapes. That's when people are being exposed and covered up. And again, that sort of idea of a sacred space, or a church, temple, sort of place. And then, but once the patient is all set up to go, we actually go over before we do anything, we pause for the cause. Or a timeout, and we all and everybody in the room says what we're doing. It's written on a board, and so if I'm doing a hysterectomy, I operated on a couple days ago, and it's on a hysterectomy, removal of the ovaries, et cetera, and the anesthetist the person doing the anesthesia says this is what we're doing. Mm-hmm. The scrub tech that is handing instruments off says this is what we're doing. And the circulating nurse says this is what we're doing, and finally the surgeon says this is what we're doing. And so we go over with that, and then it's okay to go. And at that point, usually the tension starts to drop. And at that point, we're trying to make the place a comfortable, at least in my opinion, in my operating room. I want everybody to be comfortable. I want them to be relaxed. I don't want anybody to be tense. That's when we put on music. Often some surgeons are like I was helping a urologist out the other day, and he was playing show tunes and, like music from all these different heavy kind of epic movies, which I rolled my eyes at, but that's what he wants.
Right.
In my operating room, I like soothing kind of acoustic rock stuff, nothing too agitating, but and it really is, and this is where the surgeon gets to decide, I want this.
Right.
This is because I want this. Wah, wah, wah.
Well.
But I try to get consensus. There's a few things I just cannot stand, but I try to ask around and never come up with some consensus.
Right.
And, and we try, in my opinion, I try to make, and everybody's different, every surgeon's different, but you try to make an environment that's comfortable for the surgeon and everybody else. And there have been times when, once the patient is, prepped and draped and, not exposed anymore, people kind of will start singing. I've done it. You've heard me. I love to sing. I love to dance. Sometimes I'll be kind of shuffling around. And, the video that I saw that you actually showed me, Twila, was a doctor who was with exposed patients, number one, videoed, and the patient, there's within the realms of normal. And then
the difference between, because I remember us when we kind of had a little bit of an offline conversation about this, that there's a difference between like I'm kind of enjoying the music, I'm kind of relaxing a little bit into what is going to be something that I do, and I'm trying to get myself in the best headspace to do it.
Yeah.
As opposed to this particular video. This person was filming it as if it was going to be posted somewhere publicly. They were purposely making something to be put on social media.
Yeah, and there was a picture of somebody's bare butt on there.
Yeah, there was like
that's not good.
Yeah, they were recording in the middle of a procedure. Like you're not talking about like stepping away to do a soft shoe in the middle of a procedure. You're talking about like in the prep immediately before a procedure when you're adjusting to the room. This person had an exposed patient on the table. In the middle of a procedure, was doing choreography for the camera, had the techs, had the nurses and stuff behind them doing choreographed stuff. Like they were doing this on purpose to use it for some other purpose. And I just found that super abhorrent because, unfortunately, out there in the world somewhere,
Yeah.
right at this moment, that person that was on that table is going to recognize something that makes them know that was me.
Right.
And then they're going to feel humiliated that they
Right.
were a part of this. And they're going to feel humiliated that they were violated in that way.
Exactly. And so unless you were going to do something where the patient gives consent, it's
Right,
all about
which-
consent.
Right.
And so, and you can't really give consent afterwards. You'd have to, I can't even imagine how you could.
Yeah,
really
I can't
do
imagine
this,
that
but I'm just
I
saying-
can't imagine. But I mean, somebody might, but I can't imagine somebody really wanting to do
But
that.
I do want to just say, I want to tell you a very quick little story, which is it kind of goes along with this. But I want to end before I tell my story about this again about how respectful and careful people are.
Yes.
So
This
and-
is not.
and there's always going to
this
be
person does not reflect the whole of the industry.
Yeah, there's always going to be a rotten apple here and there, and people make stupid decisions and stuff. But I had a patient whose husband worked for Prince, right?
Mm-hmm.
Prince had a million different employees, so I'm not
Yeah.
violating anything. But she was pregnant, and we went to do a C-section. And she said, "Can we play Prince's new album? This is his last album."
Right.
And so, sure. So we take the CD, we put it in the player, and we crank it up. And she's awake, she's alert, and everybody was dancing.
Mm-hmm.
I was dancing. Everybody was dancing, but she was involved. She was part of it. She was awake and alert. And
Well, she wanted to create a certain
yeah,
environment.
and she was laughing her butt off. She loved it. And her husband was videoing it. Not me, not anybody from the hospital staff. Her husband was videoing this. And so we did the C-section. Everything went great, of course. And anyway, I saw her a couple weeks later, and she said that her husband had run into Prince, and Prince said, "How's everything going? I hear you had a baby." And this guy said, "Well, I just want to let you know we played your album during the C-section," and he showed Prince the video of all of us kind of dancing around, and he said Prince was just loved it. He just absolutely loved it. It was very meaningful for him.
Right.
So that's my celebrity touch.
Well, there you go. I always appreciate that.
All right, thanks for listening. Have a good summer.
We won't be gone that long. We'll be back soon with new episodes. In the meantime, we appreciate you getting to talk to us.
Yes.
We'll talk to you soon.